Hi, I'm Ephraim Hochberg. I'm the Associate Chief for the Mass General Hospital Cancer Center. I help manage operations at both our Boston site as well as our Waltham and Newton Wellesley sites in our Danvers location. And I'm honored to be joined today by Amy Comander. Amy?
Hi, I'm Amy Comander. I direct breast oncology and survivorship care at the Mass General Cancer Center at Newton Wellesley and in Waltham. I'm also co-director of the MGH Cancer Center in Waltham.
Excellent. Thanks very much for joining me today, Amy.
Thank you.
We thought it would be important to talk briefly about our network locations and how we think about the care that we provide at these sites. We continue, despite the COVID pandemic, to provide exceptional care in the local communities that we serve. Amy, you play really a unique role within the Cancer Center. You see patients both on-site at Newton Wellesley Hospital, and also, as you mentioned, you're the co-director of our Waltham site. Can you comment about the care that we provide at both of those locations?
Thank you. Absolutely. I think we really pride ourselves in taking top-notch care of our patients at the community locations. We know our patients are so grateful that they can receive personalized, comprehensive care closer to home without having to deal with, traffic getting into Boston, et cetera. So we have a wonderful team at both locations, and we really, truly love providing the best care for our patients.
I think one of the points that we think it's really important to make is that many of our most senior clinicians go to see patients at each of our network sites. Our sites at Waltham, Newton Wellesley, and Danvers are close to where some of these physicians live, and they've really enjoyed the opportunity to become more embedded in the local community. Can you just comment on some of the senior experts who are seeing patients at the Waltham site in addition to yourself?
Absolutely. We're very privileged to have wonderful senior colleagues at both the Newton Wellesley location and the Waltham Cancer Center location. And it's really wonderful to have the opportunity to discuss cases with my colleagues, for complicated situations. In addition, we always have the opportunity to discuss cases in tumor board and other conferences. So there's so much support from all of our colleagues. It's great.
And this is also across multiple specialties. So we have senior radiation oncologists as well as surgeons seeing patients at all of our sites, the exact same clinicians in many cases who are seeing patients in downtown Boston.
Yeah, that's a great point. For example, as a breast oncologist, I have the opportunity to see new patients in a multidisciplinary clinic with my breast surgery colleagues, radiation colleagues, and of course, we also have our genetic counselor and nutritionist and all these wonderful supportive care services. So our patients really benefit from meeting the entire team when they are diagnosed, for example, with breast cancer.
Our goal in this new era is to provide seamless care across all of our network sites, that the full spectrum of comprehensive cancer care is available to patients, from their initial diagnosis, their pathology assessment, their radiology evaluations, their surgery, through their therapy, through their comprehensive genetic assessment, and then finally into survivorship. And that entire spectrum of comprehensive care is provided across all of our sites in a really seamless fashion.
Yes, I would definitely agree. We take great pride in taking care of our patients each step of the way, from, as you stated, from screening to diagnosis to formulating a treatment plan and to supporting our patients during the survivorship phase of care.
It's really important to note that we respect the concerns in the COVID pandemic, and we've taken exceptional care to make sure that our patients are safe on location. Every patient before they come in has a pre-screening phone call. They have a pre-screening message sent to them through our patient gateway. Every patient, when they walk in the door at any of our centers, are screened in person for potential COVID symptoms. Even if they do have COVID, that doesn't change the kind of care we deliver. We have a separate pathway for patients who are COVID positive to continue to get the surgery, the scans, and the chemotherapy they require. That's given at a different location, not in our network sites, but it's important to recognize that we have the potential to care for every patient equivalently, regardless of their COVID status, but also to keep most of our sites with limited exposure to COVID.
I would definitely agree. As you noted, we have safety protocols in place to ensure our patients are safe. And I can tell you from my experience over the past few weeks that at both of our locations, our patients have felt extremely safe coming in for care, given all the practices that we're following at this time.
Thanks very much. Amy, any concluding comments you wanted to make about the care at Waltham?
I just want to say that we're here to see you and provide the best possible care and in a convenient location closer to home.
Thanks very much, everyone. We look forward to seeing you at Mass General Hospital Cancer Center. You can log on to the main Mass General site and pull up the Cancer Center link and read more about each of our network locations. But we look forward to taking care of you at any of our convenient network locations. Thanks very much.